I'm Dr. Dominic Foti. I'm a board-certified plastic surgeon in Colorado Springs, Colorado, and I'd like to talk to you today about breast augmentation surgery. I would like specifically to talk about the three primary incisions that are utilized for placement of the implant for an augmentation. The first and most common incision that we utilize for augmentation mammoplasty is the inframammary fold incision, which is right underneath the breast. Typically the incision is about 2 inches or less in length and gives us a very good approach to placement of the implant as well as developing the pocket without getting into any of the breast ductal tissues, and helps to minimize the risk of bacterial contamination, which can cause infection or hardening of the breast, called capsular contracture. The disadvantage to the inframammary incision is primarily the fact that we just have to make an incision on the breast, but that's true of most of the approaches that we would normally take. The second approach that can be utilized is what we call the periareola incision, which goes from about the 3 o'clock to the 9 o'clock position around the areola, and that can camouflage fairly well, but the scar is visible when you look at yourself in the mirror. It also requires us to incise or make an incision into the breast ductal tissues, which again will give some contamination of the pocket with bacteria that naturally exist within the ductal tissues, and you can also end up with a higher risk of hardening of the breast capsular contracture, which can be due to the bacteria that can be present. The third approach that can be utilized is a transaxillary approach, which is through the armpit. It's not used very commonly because of the fact that the incision itself tends to heal fairly poorly every time you wear a bathing suit and a sleeveless shirt, your scar will be visible. It also has the highest risk of complications because of the long distance from where we would make the incision to where we are trying to create the pocket, and as a result we don't utilize that in our practice. I hope this has helped you with understanding the various options from an incision standpoint. If you have any questions at all, please do not hesitate to contact me at 719-473-2932, 719-473-2932, or visit us at our website at drfoti.com. That's drfoti.com. Thank you.